welcome to Well Within Reach. And we have with us today Mr. William Hart, and we also have Mr. Damir Finch. Both gentlemen today are representing the African American Male Wellness Agency, along with so many other hats that they wear. And I'll let each gentleman kind of tell you a little bit more about themselves. But today, we want to continue our conversation talking about African American men and their health issues. And we know that you guys are doing some phenomenal work, not only here in Philadelphia, but across the United States. And I think, Mr. Finch, last check, it was 23 cities that you guys are in. So I'm going to turn it over to you, Mr. Finch. Tell a little bit about yourself, how you got started in this work, and then we'll bring Mr. Hart in, and then we'll just kind of talk.
I'm so glad that you let me go first before Mr. Hart because I would hate to have to follow that, good brother. But good morning, everyone. Good morning to the listeners. Dimer Finch here, Executive Director for the National Center for Urban Solutions, as well as our Health and Wellness Extension, the African American Male Wellness Agency. Also serving under our first Black female mayor, Mayor Sherelle Parker's Commission on African American males for the city of Philadelphia. On that commission, I serve as the health and wellness chair. So, uh, doing what we can to provide, bringing the clinic directly to the community, and what we also like to call the most fun you can possibly have at a doctor's appointment, and then using those statistics to turn around some policy recommendations on behalf of Black men and boys throughout the city.
Wow. With that said, my introduction is going to be short, but hopefully as impactful. So, most of the time, the day job is working at one of the largest public research universities, which is Temple University, which has been home for the African American wellness work that we've done in Philadelphia for the past couple of years. In addition to that, working on a campaign for a congressional candidate who's been our primary sponsor for the past, I mean, has it been the past 3 to 4 years that Senator Sharice Street has been the primary sponsor, making sure that we fund the work that we do with the goal of saving Black men's lives. How I got involved with the work, I hate to say it, but I was voluntold. When Damir pitched what we needed to do, he says, Bill, you're the guy to make it happen because you can connect dots at the university. You can connect dots with the research that the health system does and just connect dots with other resources. With that said, and I have to say in all candor, it's exciting that we are hosting the largest, most comprehensive Black male wellness event in the city. Correct me if I'm wrong, but I don't think I am. In addition to that, we're also addressing mental wellness with our Real Men, Real Talk, creating safe spaces for Black men to have real vulnerable conversations, all of that tying into their mental and physical well being and health.
That's phenomenal. So let's talk about this event, this get checked out and not checked in. I love it. I love it. So tell us more about this, Mr. Finch.
Yes. So our Get Checked Out, Not Checked In campaign is to be as preventative as possible. So, like I said, this is our way of bringing the clinic directly to the community, eliminating all barriers or excuses to access to quality care. So, with that being said, we'll have over 20 free biometric health screenings for our men. We'll have up to 5 health screenings for our women. We'll have youth sports physicals for our youth along with something for every part of the family. So, to Mr. Hart's point, this is the most comprehensive day in which you can get all of your health screenings and health things done. And I would also like to add, for those that's listening that are uninsured, this is an opportunity to save up to $10,000 with not having to do a copay or not having to put your insurance on the line for these said screenings. And then for the individuals in which they are insured, this is also a way for you to still save some money and save your insurance by not having to use your insurance. So, um, definitely an opportunity for individuals to not only save money, but to get healthy and well all in one day. And we also have a 5K walk slash run to promote the healthy movement as well.
Hey, Damir, just to I'll say add on to the savings in money. And Dr. White, you can probably co-sign on this. There are a number of screenings that we do that the insurance industry will not pay for, in particular that peripheral artery disease screening that Dr. White's shop has done for us for a couple of years. And that's one of those super screenings that once done, you'll get an insight as to whether or not there are blocked arteries in your body. And that's like a great thing to know if I had blockages and I'm about to fall out from a heart attack because I don't know it. In addition to that, Damir mentioned that we have quality care. I like to be able to highlight that we have some of the best and brightest medical minds. We start with our Black doctors with white coats. These are Black men, Black women that are practicing medicine. They've been doing it for the past 4 years, that are committed to providing resources to people like themselves. Our professionals from our health systems, be it Temple, be it Einstein, be it Jefferson, have all committed. And these are volunteers, and they commit to come through freely we start at 7:30 in the morning. And our professionals are there providing some of the best services and quality care because it matters to them, just like it matters to us that we're having an impact on lives of people of color, people like my dad, like my uncle, like OG down the street, that we can provide resources that save their lives. So it's exciting work, and the quality, I cannot emphasize enough, the quality of the professional providers that we bring to our resource fair, to our wellness fair, are second to none.
Well, you guys are in so many cities doing this work. I just want to know a little bit about the impact of the work that you're doing. Tell us a little bit about, what happens once these men are screened. Are you finding that they're going to see their providers? What has been the impact of this work?
I'll turn it to Bill Hart to lead this first one because he has a story. We were able to travel to Houston, Texas together on behalf of our Black Men's Wellness work a couple years ago. And there was a
Mhm.
gentleman that shared a story with Mr. Hart that I would love for him to kind of reiterate to you all that are listening today.
So now, quiet as kept. We're in Houston. We get there Friday night, and if there wasn't a storm, there was a rainstorm. In my mind, Saturday morning at 7 o'clock in the morning, ain't nobody showing up to come get some wellness checks. When we reached the site, and it must have been 6 in the morning, we're starting to set up. By 7 o'clock, there were thousands of people already there, congregated, prepared, prepared to get checked out, checked in, get a lot of information. But I had a conversation with this one guy, OG, and we get to talking. He said to me, he says, he says, I've been driving cars. He said, I got a caddy, I got a custom van. And he says, I know when the pressure in the tires are down because the car drives a little differently. He says, I know when I don't use quality gas in it because it pings a little bit and it don't accelerate the way it's supposed to accelerate. He says, I know every time that I need to do an oil change. As a matter of fact, he says, I got a tickler on my device that lets me know every 3,000 miles I need to be getting my oil change. But when I asked him about his health in particular, because it's a passion of mine, prostate work and prostate health, I asked him what his PSA was. And he looked at me with that quizzical look, like PSA, like, what did that mean? So I explained to him that PSA was a product, and I'm going to butcher the word, but Dr. White knows what I'm talking about. It's a test to determine
Prostate, yeah, the prostate
screening.
specific answer. Yes,
Yeah.
uh-huh.
And
Mhm.
I explained to him what that was. And he paused and he looked me right in the eyes, and in a very soft voice, he says, you know what? I just came to the realization I know more about my car. I know more about my car and how to keep it running on time, on schedule, than I know about my own health and well being. And that was one of those let's drop the mic moments. And he looked at me and I looked at him, and then he proceeded to go get checked. And we had a
Mm.
conversation afterwards. And he said, well, he says, I did the blood check. And he says, I don't know. I took his number because I wanted to follow up with him, no different than we do with many of the folks that we serve. We do follow up to make sure if there's some recommendations for follow-up screenings and or we need to know what you're going through, we can at least provide that service. And he said to me, he got his blood work back and his PSA was like 5. And that was above that 4.0 screening level. And he said, I went straight to my urologist and I started working on prostate exams. That's an example of the impact of the work that we do. And a sidebar, and it's not necessarily from our Houston event, but last year, and Damir, correct me if I'm wrong, we heard that about 60 to 65% of the men that we screened were unaware that they had high blood pressure. Unaware of high blood pressure. And Dr. White, you and I've talked about it. In North Philly, there's certain zip codes in North Philadelphia where we have the highest incidence of below the waist amputations of Black men in the state of Pennsylvania. The highest incidence of below the waist amputations of Black men in the state of Pennsylvania. And the common denominator with that is high blood pressure and diabetes.
Yeah, and to kind of piggyback on what Mr. Hart is saying, last year was a huge year for us. We were still able to be as impactful as we would hope to be. With that comes the challenges of uncovering things that men may have not known before that day. Men are oftentimes under the impression of what they don't know won't hurt them, and we know
Mm,
for a fact what they don't know will kill them. So we
Mm.
oftentimes sent men directly from the event to the hospital. We had to send 4 gentlemen there last year. But something that was key was, like Bill said, over 65% of the men that we screened last year, they were in the range of hypertension 1 or hypertension 2,
mhm,
um, which is extremely alarming, right? Something that we want to monitor and check as we do this for years to come. Um, 200 individuals specifically had alarming numbers and were followed up with within 30 days of that event from volunteers of the event to also connect them to continued care. So it's an initiative, it's a movement that takes place the first Saturday in June that we look to support all year round.
mhm,
Well, I actually think it's incredible having participated in the event. I think it's phenomenal work that you all are doing, not just in the city of Philadelphia, but throughout the whole nation, the whole country. I mean, you're in 23 cities, and I just want to I want to go around and kind of give your pep talk, if you will. How do we get men to come out to this event? How do we get them to just look at their health in general? You know, how do we get men to care about their health?
Let me try to stab at it. So I mentioned to you earlier that we do a series of Real Men, Real Talk, where we host conversations with men behind closed doors, where we unmask. We close that door and we get rid of all those facades, all that old macho stuff, and just have some real talk. And I can't tell you the the impact of, hey, we need you around. We need you to be a dad to your daughter. We need you to
Mm.
be a husband to your wife. We need you to be a patriarch in your family. We need you to grow old because if you don't grow old, you die young and it's over. And to have that kind of male to male conversations about how significant we are just as men as human beings. And there's a certain responsibility in that space that you have to take care of yourself. And for us to be able to have that conversation and then bang, we also are doing the wellness screenings for free. And we're going to reach out to you. We're going to come get you. We're going to call you on the phone. Matter of fact, we're going to call your woman. If we know who that is, we're going to call your woman and tell her she need to get you out because we need to be around. Now, and Dr. White, and tell me if I'm wrong with this particular stat. I want to say in Pennsylvania, the life expectancy of a man like myself, a man like Damir, is 10 years less than the life expectancy of my white brothers. And it's a combination of its diet, its exercise, its access to affordable care. It's being able to address some of those stressors that we don't talk about. And as a result of the work that Damir does, as a result of the work that Dr. Gregory is doing nationally, we're able to remove those barriers. And when I say to you, 7 o'clock, 8 o'clock in the morning, you see Black men lining up. You know, it's hard to get a brother out at 8 o'clock on a Saturday morning. to come do a little something, something. But driving home the impact of we need to be around, Black men need to be on this planet because we play a critical role for the survival of us as a people.
Thank you for that, Bill. And last but not least, we're going to have Mr. Finch leave us with some encouraging words and Finch wisdom.
Oh, oh man, this was better suited for good brother Mr. Hart. If I had to leave you all with some wisdom, it would just be something that me and Mr. Hart oftentimes say, and say to men. We echo it as loud as we can, and it's just a simple quote. It's okay to not be okay. It's just not okay to stay that way. So wherever you are, we understand there's different seasons, and there's different reasons for those seasons. We just don't want individuals to feel trapped forever in those seasons, and they know that they have some help on the horizon.
I told you guys you were going to get that Finch wisdom, didn't
Yes, you
I?
did.
Well, gentlemen, I thank you. We want to provide some information for individuals who may be listening who want to find out what's happening here in Philadelphia as well as across the country. So we thank you all for your work. We appreciate you because we know this is not an easy task. Getting thousands of men together is very difficult, and we know you all start working very early on to get this accomplished. So I just want to thank you, let you know that we appreciate you, and we're here to support your work.
Dr. White, thank you for having us. And our goal this year is not thousands of men, it's 10,000 men.
All right.
So
All
yeah,
right.
June 6th, you know where to find us at 7 a.m., 1816 North 15th Street on the corner of 15th and Montgomery. We'll be in the Indoor Star complex on Temple University's campus, and we'll be there till 1 p.m. So you have a good 6-hour window to come get your comprehensive screenings completed.